You can start now, sir.
JP, you can start.
Okay. So directly I have to start, sir.
Yes.
Okay, actually 8:15. So just now I circulated.
ठीक है. We will wait for another 1 to 2 minutes. No issues. You want me to give some introduction?
If you feel, then it's good.
Okay.
But actually, academic thing, we should directly go on the topic also. Okay. What is your protocol? What you people are doing previously?
We go directly with the talk. We go directly with the talk.
Okay.
Because already flyer introduction सब चल जाता है सबको.
हाँ ठीक है. Full screen I'm just seeing, sir. How I can do the full screen? It's coming, sir, full screen.
Yes. आ रहा है. Yes, it's coming.
Okay. So shall I start?
Yes, please proceed.
Good
Please start.
morning. Good morning to everyone. So why this topic need to be discussed here? Because if you look at the clinical practice, day-to-day practice, you will feel that what is the evidence? So just see this pyramid where you are getting that meta-analysis and systematic review are on the top of the hierarchy of the scientific evidence. So the title of the topic is a stepwise approach to systematic review and meta-analysis. That means how we'll proceed, how we'll go, how we will make the evidence. So first, I would like to acknowledge that I prepared this presentation with the help of Cochrane Review, my published article, you will see later, and gratitude to all the authors for their efforts. Now, although systematic review and meta-analysis, it's a very lengthy, time-taking process, but yes, the final result, if you will get, you will feel that no, the evidences so far coming is really nice. So we already arranged many program on that one through ISAV or IJ. We organize a planning of systematic review, what all to know with Dr. Rakesh Garg. We previously also organized in Delhi. So how you will learn that? Basic thing is that suppose that if I'm here giving lecture, so how you will learn that? Because after reading through the published article, it is very difficult to get until and unless you will be aware of that, you will be in touch with that. Many programs we are organized in that in our SPACON, in W4C conferences also. So now there is no miracles, people. It just happened that they got interest in this thing and they learn all these stuff. They are just people. Who said this one? Richard Feynman. So if you will build a concept, there are 4 important steps you have to proceed with that. Suppose that if you are making a concept and how you will make on the platform, how people will recognize you, how you will get benefit. So there are 4 steps basically to learn any subject. How complexity, it is no matter. First, make a concept. Similarly, in cases of systematic review and meta-analysis, you have to frame the question, and then after that, you have to teach yourself. And from where you got this concept, you have to again return back to that source material. And last but not the least, that simplify your explanation, analyze by yourself that how much you got, and you will see later that how we have to proceed by a step and a step. So basically, I prepared this PPT based on the workshop module so that people can learn. So now the basic concept, as the name is indicating here, systematic. What does it mean, systematic? That all the things are in a specified form, predefined form, So that systematic review, what addresses the, it addresses the a specific research question, whether it is based on the treatment, whether it is based on the diagnosis, prognosis, or any cause. How? By using the explicit methodology, by pre-registered protocol, by collecting, selecting, and appraising the previously published study. When you are feeling that now my protocol is appropriate, how we have to proceed, we have already a predefined protocol. So finally, you are synthesizing their results. Now, if you are seeing that systematic review, if you are seeing that meta-analysis, so what is the basic differences between that? In a simple form, meta-analysis, meta, you may say that if you have data, you can proceed with the meta. So systematic review answers a predefined research question. As I earlier said, that by collecting and summarizing all empirical evidences. If you will see that the meta-analysis, basically we are using a statistical method to summarize, to synthesize the results of all the included studies. Now, suppose why we have to take systematic review rather than the literature review or narrative review. So by collecting the or including the many studies, you have to first summarize the literature. So finally, you will get no, this is having less bias, transparent, and reproducible. If you will include many studies, suppose that if you are including 8 or 10 studies, by getting the result from one study, definitely it will be more powerful. Suppose that you are sitting in a symposium with the many people, and all are clinically experienced, and by their one by one taking your concept and final conclusion, what exactly we are doing in the consciousness statement, position statement, or any guidelines. So the power will be more, and this is the source for the evidence based practice. Now suppose that if someone is asking, shall I we do a one randomized control trial with a well designed study rather than systematic review? Why we can believe only on the systematic review? What is the need for this systematic review? So if you will ask the, if you go through the literature, you will feel that no, because about 32% of a set of a study, if you will get even with 1,000 citation, we are either contradicted by or reported with a stronger effect than subsequent studies. You will get the result by the systematic review is quite good, and it is based on the evidence, and what exactly evidence you are synthesizing with all the checklist. You will feel that the power of this systematic review is quite more. Now, so what is the basic difference between the systematic review or literature review? Yes, as I earlier said that the name is systematic. So definitely it will give the high evidence, as we are proceeding with the predefined protocol that we are following as rule, that once we are making a protocol, and suppose that if you are publishing the protocol, so or you are registering in the Prospero, so it will come in the public domain. You can't deviate from that one. So that means you are, the chances of the bias will be low. So one by one, that with that registered protocol, you have to proceed. And if you will look at the transparency, if you will look at the reproducibility, you will feel that this is quite good. Now, what is the relationship between the systematic review and meta-analysis? So basically, systematic review, if you will see that if you are collecting data, many papers, and from many papers you are collecting the data. So definitely systematic review is the broad term, and it is the process of undertaking the review. However, if you will see that meta-analysis, it is mainly concerned in the outcomes. So what is your primary objective? What is your secondary objective? Based on the data, you are synthesizing the result. So not all systematic review include meta-analysis, but yes, all meta-analysis are found in the systematic review. So if you will include many studies, suppose that if you are including 3 studies, So the combined effect estimate, if you will see that, it will give the more power. Why? Because suppose that if one study coming with the 100 sample size, second study is coming with the 150 sample size, like that. So by including all these studies, the sample size will also increase and the power of the study will also increase. So what is the main advantage of this meta-analysis? First thing is that when, if suppose that uh, there are two methods, intervention, and one study published with in favor of A, one study published in the favor of B. So what exactly you will confuse? So by doing this meta analysis, whether by looking this one, how you will go and on which you will believe. So if there are any study with the conflict, you can proceed with that to proceed produce a precise effect estimate. And yes, what I earlier told, that the power of the study will be the increase. So what is the need for this meta analysis? Suppose if you are proceeding with that, why you have to do that? So basically thing is that to synthesize the evidence, that is the main reason. How it will, I will show you one by one so that it will be very easy. Now, suppose I am giving the example of my published paper. So, suppose there are two blocks, pericapsular nerve block and fossa iliaca compartment block. During hip, what exactly we are doing, that we are using for the hip orthoplasty. Suppose many study published because paying that pericapsular nerve block is new block. So, if you will look at this study, you will feel that most of the study are in the favor of paying block. But if you will go through the fossa iliaca compartment block, FICB block, you will feel that few studies are, although sample size is large, and they are in favor of FICB. So by this contradiction, how will go? So again, suppose exactly same happen. We all know that the procalcitonin basically we are using for the antibiotic de-escalation. So during COVID time, there was confusion that procalcitonin, whether it is a predictive marker for COVID or not. So you have to first make a frame, you have to make a research question, that what exactly you want to know that. And after that you are making a protocol that by this criteria we will proceed and we will look at the confusion and we will make a synthesize a evidence. So similarly of that role of mycobacterium indicus pranae, what exactly we are using, that sepsivac. So what is the clinical outcome in patient with the sepsis? So we wanted to know that whether it is effective in cases of sepsis or not. So first thing is that why I have shown all these slides, because you first, what is your concept? After reading of the many articles, you will just you will feel that no, this result is contradictory. I have to work on that. Second thing is that if you have any confusion or you are any conflict, so first you have to frame the research question. How you will frame the research question? One by one I will show to you. Now, so which type of systematic review we are doing that? Suppose that if you are including the study of the randomized control trial, that means interventional trial. So this is called intervention review. If you are including a study of only observational study, whether you are like to find the diagnostic accuracy. So all these we are framing according to, based on the types of the systematic review. So must remember that systematic review address a need for the health decision maker. So guidelines, many guidelines are published by the Indian Society of Critical Care Medicine or any medical fraternity society. So exactly how we are going. And one thing is that how we will give the power, that no, by grading also we are giving that this is having the low certainty of evidence, moderate certainty, and a strong sensitivity. So certainty is totally based on the grading. So I am not going in grading. So systematic review aim to minimize the bias. It is the good thing is that at least you need three people, because all people are doing their separate analysis, and finally they are combining the results by looking at the discussion. If any on any matter, if any disagreement, so by discussion they are making on a single platform. So systematic review is conducting by a team. Now, important thing is that if suppose that if three people are work separately, so the chances of the data management will be quite good, and quality assurance will be. So systematic review attempts to collate all empirical evidence, that what I earlier told, that we are proceeding with the pre-specified eligibility criteria or predefined protocol. So first thing is that we are proceeding with the specific research question. We are using the explicit methodology to minimize the bias, and definitely the findings will be the reliable. So now coming to the how will we proceed, that is important, because basic things what I wanted to say to you I already said. So how will we proceed? Suppose that if you are reading many literature and not on the conflict, if you want to synthesize the result, you are feeling no, I should work on that. So first, how you will make a research question. Now, giving with the example, this is the published paper that modified Nutric score as a predictor of all-cause mortality in critically ill patients. So basically, we wanted to see that because nutrition is very important in the ICU. So, what is the role of Nutric score in ICU? Even by looking the all-cause mortality. So, how it is going to affect the outcomes, that is 28-day mortality or 90 days mortality. So, this is our research question. Now, proceed with the Prisma 20 checklist. There are 27 checklists on that one, because this or as I said that we are proceeding with the predefined protocol. So one by one, you have to go through that. Important thing is that suppose that if you are preparing a protocol, so in methodology, first you have to make PICO format questions. After framing the research question, go through the inclusion criteria, which paper you are excluding. So, because in systematic review and meta-analysis, we are not doing trial. We are synthesizing the result based on the published literature. So, for suppose that if in inclusion criteria, you are including what we have to write in that one, we are including randomized control trial, we are including observational trial or cohort studies. So studies we are including that. So what will be the search strategy, selection process, how we have to collect the data? So one by one there is already formed a checklist. So look at that and proceed with that. Now, so steps of systematic review. First, frame the research question. Second, you make the eligibility criteria that uh, we are going to include this kind of studies, uh, inclusion criteria, and exclusion criteria, that we are going to exclude case report, we are going to exclude abstract presentation in any conferences, or we are going to exclude review paper like that. And after making this, we have to make the search criteria, that from which data we will search the literature, and we will include these studies. After this, we are doing the screening, whether on my research question these studies are fit or not. So by screening, you can include your studies or you can exclude your studies. Suppose that after getting through the 200 study, you are including 10 or 12 studies. Once you selected this study is fit for the my research question or search criteria, then what exactly you are doing, that you are also analyzing the risk of bias, whether this study is having the publication bias is there or not, or what is the criteria in that one. So one by one, you can give the estimate the power of the study by looking at the risk of bias. And finally, after the data collection, you are synthesizing your result and presenting your findings. Now, how? First, after framing the research question, and how you are framing the research question by looking at the PICO. That means patient or population, intervention, comparison, and outcome. So, first thing that I have seen previously that COVID. So, COVID cases. So exactly what we are doing that we are looking at the patient or population. So what is the characteristics of the patient or population, and what is the condition or disease that we are looking for, and intervention, whether it is for treatment, whether it is for diagnosis. Now for comparison, we are what exactly we are doing that we are seeing the alternative plan by looking at whether compared with a placebo or by some different drug. And finally, outcome, what is your outcome objective? So by making that, we are framing a research question. Why? Because the problem is to address by the review should be specified in the form of clear, unambiguous, and a structured question before the beginning the review work. Now, so by inclusion and exclusion criteria, you can get the number of studies based on the pre-registered protocol. Now, giving you example here. The title of this published paper is ROX Index as a good predictor of high flow nasal cannula failure in COVID-19 patient with acute hypoxemic respiratory failure. So why I am showing this paper? By seeing this title, you can feel that research question is already in the title. So how you, because we have seen during COVID time that HFNC was better than or mechanical ventilator. If you are keeping patient on mechanical ventilation at that time, we felt that the mortality is quite more. So we wanted to see that which patient require early intubation, which patient we have to put on the mechanical ventilator, so we can, before condition deteriorate, we can put patient on the ventilator. So how we can, because there are only one criteria by uh, specified the prediction in cases of the HFNC, that was the ROX index. So for if you will see this paper, so how we will frame the research question. So our research question was whether ROX index can predict HFNC failure or not. Why? Because once HFNC will not going to work, fail, what you have to do? Either you have to put patient on NIV or you have to put patient on the mechanical ventilator. So during COVID time, we wanted to see that whether it's HFNC can predict failure or not. So once result was not in favor, so at that time we intubated the patient. Now, what I said, after framing the research question, what exactly we are doing? We are forming the PICO format. So in this, by seeing the title, you can feel the participants or the patients were COVID-19 patient more than 18 years of age. COVID-19, if I am saying that, that means it is already diagnosed with the RT-PCR testing. Now, intervention or exposure. Suppose if you are looking for the trial or interventional trial, so there you can write intervention. But these all included studies are observational studies. Neither we did in the authors did in that one. So we wrote here exposure. So what was the PICO format? Screen, can I share?
Yeah, please, please.
Yeah. It's coming, sir.
Yes, yes, it's coming. Please proceed.
Okay. So, yeah. So what exactly we did? We wanted to see that the findings. In that cases, the exposure was ROX index, and we compared HFNC success versus HFNC failure. So the type of outcomes was the HFNC failure. Just a second. Yes. Now, I am giving the example of another paper, that is computed tomography severity score, CT severity score. Why I am giving this example? So that by this demonstration, at least you can feel that you can understand it's very easily. So during COVID time, we all are aware that CT severity score. That means if CT severity score is more, the mortality rate will be more. So we wanted to look on that whether it is going to predict the disease severity or mortality in is there or not. So the research question in that one was whether CT severity score can predict the disease severity and mortality in patient with the COVID-19 or not. This was our research question. Now coming to the PICO. So the PICO was again COVID-19 patient. Exposure here changed by CT severity score by using any cutoff value. Why exactly we wanted to see that which uh, cutoff value is going to affect our the result, and comparison was the whether CT severity score was the mild to moderate, severe to critical, or survival versus non-survival cases we wanted to. So this was the comparison, and outcome was the predictive accuracy. Now, first thing is that you have to make a research question and you will make the PICO format. Now, second step is a study selection criteria. That means which study you are going to select. From where you will get this study? From the database. So, a study selection criteria should flow directly from your review question and already registered your protocol. So, it should be specified a priori. Now, why you are you have to mention your inclusion criteria and exclusion criteria also. Now, data. Unfortunately, India has no data bank. But yes, if you will feel that what is the database? So we are a database is a collection of information that is organized so that it can easily be accessed, managed, and updated. So basically, database. What exactly we are seeing that we are important database we are looking for and we are selecting studies from this database. PubMed, Embase, Cochrane Library, Scopus, Web of Science, Ovid, and Google Scholar. How? How we are selecting this database? By how we are selecting our studies? By identifying the relevant keywords. And after once you are framing the making your keywords, then you are searching that and making that keywords into a mesh form, medical subject heading, so that you can get easily in the PubMed. And finally, you are formulating the search strategy. Now, these are the database, but basically we are collecting our studies from this database only. Now, once you are selecting your studies from the given database, you are screening the title after making the research question, screening the abstract that whether this study is going to help you or this study is fit in your inclusion or exclusion criteria or not. And after once, because suppose that studies, it will, if you will read one by one studies, it will take quite more time. So by seeing the titles, by seeing the abstracts, you can save your time. Once you are feeling that no, this study we can include and this study is for our work, so then you will go through the full text articles. Now, again, similarly, what I previously produced this paper, so database, we have to clearly mention these are the search method for identification of studies. All these are given in the Prisma checklist. So once you are writing, you have to mention that which database you used. Okay. Similarly, in that paper also, again, you have to mention that which database you have to used. Now, the step third is the assessing the quality of studies, because you have to clearly say to your readers that this included a study having this quality. That means whether low risk of bias, moderate risk of bias, or high risk of bias. You have to mention that clearly. So a study quality assessment is relevant to every step of a review. And uh, if you are formulating the research question, if you are going through the study selection criteria, so you have to describe the minimum acceptable level of the design. And the once you are selecting the study, then selected study should be subjected to a more defined quality assessment, So assessing the quality study, so how you will go through that, what is the need for that. Suppose if you are proceeding with the software revman, so and after analyzing the data, you are feeling that the heterogeneity of this study is quite more. That means you have to explore the source of the heterogeneity. Now, again, quality of a study, how we have to write. I wrote clearly here, Dina, assessment of the quality of a study. You have to mention that two author conducted risk of bias assessment separately. And after that, you have to also show the analysis of the risk of bias, that this study having this percentage of the risk of bias, whether it is lying in the low category, moderate, or high risk of bias. Similarly, how you have to show that there are by looking all these diagram, you feel are very tough. No, it's not a tough. It's based on the software. So if you will see the diagram here, you will feel that green. So the risk of bias in the study participation is low. There are here, if you will see, there are 6 domains. So finally, we are analyzing overall. So 6 domain, whether it is study participation, study attrition, prognostic factor measurement, for which tool you are using. Here we use the QUIPS tool, that is good for the prognostic factor. So we used the QUIPS tool. So included, then if you will see that the number of included study, I feel that it's 12. So you have to make the risk of bias. Now, final fourth step is your summarizing the evidence. That once you are including the study, you have to collect the data. How you will collect the data? How you will synthesize the data? This is based on the make a table of the study characteristics, make a column in that one, quality and effect, by using the statistical method. Now one by one I will show you. And finally, in your analysis, you have to explore the heterogeneity by doing the sensitivity analysis, by doing the subgroup analysis, or by doing the meta regression. You have to explore the heterogeneity. So data extraction we are doing in a predefined Excel sheet or word file, from where we have to collect the data. We have to make the information about the sample size, how much sample size was in the previous published paper, what was the characteristics of the patient, how much the length of a study, how much time it was taken, so that by looking that you can feel that the bias, whether it is selection bias is there, or any kind of bias, you have to see that. I'm not going in detail. So confidence interval, odds ratio, all things you have to mention that. Now see this. That published paper which I earlier showed you, we made a tabular form. Which data we included? So suppose that here a study number. So we including 8 study. Name of the author, you have to mention that, year, which category. So all these are the randomized control trial. And suppose we use that for the compare to the ping block and FICB block. So one by one, I would like to show that. So the age, the timing for the pain score was like that. So finally, you have to make a, after in data extraction, you have to make a form in Excel sheet or you know what file, whichever is easy for you. So we made for in on rest and on movement. Okay.
Green.
Yeah, yeah. Okay, sir.
हाँ शेयर हो रहा है बिल्कुल से.
Okay. So you have to analyze the data. Final, after collecting the data, you have to analyze that which data you included in your study. So analyze the data by, or first organize is, then analyze the data by using the statistical software. Generally, we are using RevMan. We can proceed with the R software also. Now, whether you have to see whether the variables are dichotomous or continuous variable. So suppose that if let's see example, if I am using pain score by NRS, I am using pain score by VAS score. So in that cases, although both are 10-point score, but if the pain score included in all these studies in the single format, the same format, so we are doing by mean differences. By operating the RevMan, easily you can make it easy. There is no need to work by yourself. All software, uh, it will be done by your software. And if these are in different form, then we are using the standardized mean differences. Now, step 5 is the interpreting the findings. So already I said about the 4 steps. Then risk of publication bias and related bias should be explored, and explore the heterogeneity by sensitivity analysis, by meta regression. By must have to explore the heterogeneity so that readers, or it when it come in the public domain, at least they will get that these are the findings where whether this heterogeneity came, why this heterogeneity came. So one by one you have to show that. Now, this is I have taken from that published paper of the ROX index. So here we use the HFNC success in how much sample size, 164. HFNC failure in how much it happened in 108 patients. So these are the demographic parameters and characteristics of the patient that was published in the studies. So one by one you have to mention clear so that uh, after going through that your readers can easily understand. Okay. Now publication batch, which I said that you have to make it by once you are collecting the data, the and by funnel plot you will easily get that. How? By Riemann through. You don't have to work. You have to only fit the data. That's all. So important thing that, because basic thing which I wanted to cover you people, I covered that, I feel. And by going through the my personal suggestion is that how you will learn. This is not a rocket science. Easily you can learn that. Just watch few YouTube video and read some published literature. At least 3, 4, if you will read, na, you will get, no, this is very easy. And the good thing is the systematic review and meta-analysis is that once you will make a paper, is going not a so much tough in comparison to randomized control trial or observational study. This is very easy to publish in a good impact journal. So I showed here you link Cochrane training where there you can Rayman 5. This is latest software. You can easily download. This is the free software. You can easily download. Now, after downloading, what you will do, how you will fit the data. So, in a step, I would like to show you here. Just download the, click on the file here. So once you will click on the file, you will get the next. So click on the next, and from there, whether you are doing systematic review and meta-analysis for the interventional study or for the diagnostic study, simply you have to click on that and then put the next button. Then again, you will get the protocol. Many people are also registering protocol on that one, but I'm here concerning about the full review paper. So click on the full review paper and then press the button of the finish. Then in that cases you will get this kind of screen. Now one by one authors, you have to put the name of the authors of that study. One by one, easily you can do that. You can get that in the YouTube video also. This is very easy to understand. Now once you are framing your protocol, you have to make register in the Prospero, so that the validity and the when the reviewers are going through that, at least it should be very easy to understand. Recently we just registered one paper in the Prospero, so must register your protocol in the Prospero. You will get the CRD number, registered number, and because you have to mention that in your study manuscript, you have to mention that. So based on that, I feel that I wanted to show that how you will proceed, that the basic thing, how the stepwise how you will proceed, you have to go through. I feel that I covered that. Thank you.
Uh, thank you, JP, for taking us through the step-by-step approach of how to do a systematic review and meta-analysis. Many a times whenever we talk about systematic review and meta-analysis, we all, as you rightly said, there is always this fear that uh, it's very complicated, and you need a lot of training and research to do it. But you have kind of simplified the whole concept and have said that it's uh, JP, you mentioned a couple of times about the use of software. Is it freely available, or somebody has to, you have to buy them?
What, sir? For Rayman is, you
Revman is
are
free, isn't it?
Rayman is free. That most of the thing is here. You don't have to spend money for that one. Simply you will
Okay.
Rayman is free. From there, important thing is that how you will first frame a research question with
Yes.
on what topic you want to work, and
Okay.
one by one, although this is time taking process, you have to give time on that one. So it's not tough, sir, because previously when I started I feel that very tough, but once I started I feel this is better to publish in a good journal.
What is the average time you take to publish one review meta-analysis?
Sir, suppose that if you three peoples are working on and they are giving time, so even in 1 month you can do that. How many study you are selecting? Suppose that if you are including more than 20 study, so definitely it will take more time. If you are including 7 or 8 study, so the time will be less. But in average, 3 months is quite good for that.
Okay. Okay. 3 months is a very decent time.
Yeah, yeah. But 3 month daily you have to give time.
Okay. Okay. See, for all the audience, it's very important. See, whenever you hear speakers or you go through lectures, many of them publish certain slides or kind of show some slides and quote systematic review and meta-analysis as evidence for whatever suggestions or whatever they speak. Now, it's very important that for us to know whether the systematic review and meta-analysis has been done properly or not.
Yes,
Because
that is why if you will go through the study, sir, na, you will feel that the authors already clearly mentioned that risk of bias, by grading they are showing the certainty, the quality of evidence. You will get in a published paper very easily, and by that is why the evidence, the uh, what exactly guidelines are following that grading. So you can simply whether there is weak recommendation or the certainty of evidence is strong or not, it's already mentioned in that published paper, sir.
yeah, so that's precisely what I want to say. So even for us, when you're looking at a meta-analysis, when we are quoting, we also need to know whether that particular meta-analysis has been done properly or not. And by going through all the metrics that Dr. Jayaprakash has just shown to us, like whether the heterogeneity has been adequately addressed, the quality of studies, and the overall estimate effect. Thank you, JP. Thank you so much for spending some time with us. Uh, if there are any questions, please post in the groups wherever you have seen the link. We will connect with the speaker and get back to you with the solutions. Thank you, JP. Thank you very much.
Thank you so much, sir.